Athlete's foot is a fungal infection that affects the upper layer of the skin of the foot, especially when it's warm, moist, and irritated. In this video, we're going to look at what athlete's foot is, what causes it, how to treat it, and finally, how to prevent athlete's foot altogether. So stay tuned until the end. Hi guys, Yusuke Arslan back here, Media Pharmacist here on YouTube. This week's video is on athlete's foot. Smash the like button below to help this video be seen to more people to hopefully help reduce more foot fungi. Athlete's foot, also called Tinea pedis, is a contagious fungal infection that affects the skin on the feet. And yes, it is contagious. It can spread to the toenails and even to the hands. It's called athlete's foot because it's commonly seen in athletes since their feet can become very sweaty while confined within tight-fitting shoes. Up to 70% of people will at some point develop athlete's foot, which is why I wanted to make this video, giving you tips and tricks to help prevent athlete's foot altogether. It's actually the most common type of contagious fungal infection, but not to worry as it can be treated with over-the-counter medication. Chances are you probably caught the fungus through direct contact with an infected person, or by touching surfaces contaminated with the fungus, showers, locker room floors, swimming pools, to name a few. So you don't need to be an athlete to get it, but if you are one, interesting to note is that experts say that plastic shoes, which warm and moisten the feet the most, are more likely to bring on athlete's foot than those made from other materials such as leather or canvas. And if your socks are damp and your feet are warm, the risk of developing athlete's foot will continue to increase. To treat athlete's foot, know that the majority of cases are going to be mild and you don't need to go see a doctor. I'll go over when you should see one, so stick tuned all the way to the end of the video. You can pick up some over-the-counter medications. I also left ones that I recommend in the description below, so definitely check that out. You have miconazole, you have terbinafine, you have clotrimazole, and you have your butenafine and your tolnaftates. They'll either be in a powder, liquid, gel, spray, or cream form. Some include hydrocortisone, which is a steroid that is preferred if the area is inflamed, red, and hot, or even itchy. So talk to your pharmacist if they can recommend if yours needs the hydrocortisone combo. I personally recommend Lamisil the most in my patients since it basically does double the duty in killing the fungus and stopping its growth. It's well absorbed into the outer layer of the skin, which is where athlete's foot lives, and it comes in a cream, gel, or spray. Use the cream form of Lamisil if you have dry skin, or the gel form or spray form if your feet tend to sweat more. When you are ready to use it, remember to wash your hands before and after use and to clean and thoroughly dry the affected area on the feet before you use it. I also recommend washing the area with an antibacterial soap. Wait for it to dry, then apply. Remember to thoroughly read the directions on the medication leaflet, as each of the directions will differ depending on what you're trying, and to ask your pharmacist if you have any questions. It may look like athlete's foot is gone within a day of treatment, but no, you might still have the fungi present. So a great tip is to keep using it for up to 2 weeks on both feet to be absolutely sure. You might be thinking, what if it's just on one foot though? In the majority of athlete's foot cases, both feet are actually infected, even if you don't have symptoms on both. Just FYI. You would call your doctor if you're developing a rash on your foot that doesn't improve within 2 weeks of beginning any self-treatment over the counters, or if you are diabetic and develop one, especially if you notice any signs of possible secondary bacterial infections such as excessive redness, swelling, drainage, or even fever. This is when you would need to see a doctor. Now that the treatment is over, let's look at ways to prevent athlete's foot. Number 1, wash your feet with soap and water every day up to twice a day and to dry them thoroughly, especially between the toes. Number 2, wash socks, bedding, and towels in water that's 140 degrees Fahrenheit or higher. Also disinfect your shoes too. Number 3, don't share socks, shoes, or towels with others. Number 4, wear sandals in public showers, around public swimming pools, and in other public places because you want to avoid being barefoot here and to make sure your feet are dry before putting any shoes or socks back on. Number 5, alternate between 2 pairs of shoes, so basically wear each pair every other day to give your shoes some time to dry out between uses. And lastly, number 6, remove your shoes as soon as you're done exercising. If you have any tips I forgot to mention, pause the video and leave them down in the comments below. I hope this video was useful to you guys, and that I hope that you do share this with someone you know who could benefit from it. Like the video now if you did enjoy it, and subscribe to stay informed with all my other weekly health and wellness videos. Thanks for sticking tuned all the way till the end, and as always, thanks for watching.